Hi, this is Dr. David Warwick of Warwick Chiropractic and Massage in Lacey, Olympia, Washington. We're going to be going over frequently asked questions, and the one today is, how do adjustments work? First of all, there are many different techniques in chiropractic that are taught, and all of them work in different levels based on patient needs, but also the practitioners, and I think that is the science and art side of using these techniques. So we'll make it really simple. Many of the techniques are either by use of hand or types of instruments. And these hand type of instrument, high velocity, low amplitude, or instrument adjusting, low velocity, high amplitude, are types of adjusting that you can use with a controlled type of force or force of energy that's put into or toward the body in the spine or certain areas that it's contacted either for a period of time using different levers or approaches on adjusting the body. And that type of energy or movement to the body or the spine will reduce the amount of pressure and in some instances create a cavitation or a movement in the spine that stimulates the area of the cord, which is one approach, or nerve or the spinal cord area where the adjustments are taking place, and that changes the communication of the body. You can use a tool or an instrument. Some people know it as the activator or the pro adjuster or arthrostim, things like that. There's different types of tools that are used out there. All of them have a controlled amount of force, but they are mechanical. And they help people to function better through good spinal health. And here's the simplest way I can equate, and that I share with patients, that to break it down is like you have a fuse panel in the house, and the chiropractor uses their technique to figure out which buttons or switches have turned off in the body, and they make a contact with that using a type of force and or breath or movement in the body and letting the energy of the body start to function or heal. It brings balance back to the body. It helps systems of the body to return and function again. So that's one way. Same with the instruments. Sometimes there's a type of instrument with a specific force or frequency of energy that changes essentially the vibration of the body. All the techniques, what I've experienced is that all the techniques work in all different ways and provide health and wellness to patients. What I really think is that it's not just the adjustment alone. I think it's the healer or the person behind it that's creating that connection back to wholeness, balance, or health for the body. I think it's a person that's present with you and creates that opportunity for you to be healthy again. And you feel it. And how do I know that? You feel it through their touch, through the energy in the room when you're talking. And what I say is that you make a connection of trust with that individual. And I think that is probably the important part. It's not always the technique, but if you're open to various techniques, they can provide health and wellness, whether it's type of upper cervical, full spine adjusting, or energy-based techniques. So just be open to it. I think, when you have the opportunity to meet with a chiropractor, see if not only the office is the right fit, the provider, the healer is the right fit, as well as the techniques they're using. So I hope that information helped a little bit in your research on that. I can expand more on another article about some of the techniques that we use in the office and help you make the decision that's right for you. I'm Dr. David Warwick of Warwick Chiropractic. Thank you for listening.